Hi, everyone. This is Aaron Gelb. I wanted to welcome everyone to our seventh OSHA webinar of the year. Normally, it's a lot easier to give that introduction because we've historically done one webinar per month. But with the pandemic and all the developments that have been taking place, both over the past year and with the change in administrations, one of the things that we decided to do as a group was to add to the number of webinars and do what we could, do our part to provide you all with some additional updates on what's going on with respect to COVID and OSHA's efforts to issue an emergency temporary standard. Obviously, for those of you that have been paying attention, which I assume is most, if not all of you, you all know that we're now more than a month past the deadline that had been set by President Biden for the issuance of a temporary standard. So we'll cover that. There's been a lot of several important developments since we gave you kind of the general overview of what to expect from OSHA in the coming year way back in January. Some nominations and confirmations that we're going to talk to you about in a little bit. We're going to go over the OSHA NEP, the National Emphasis Program that was promulgated for COVID. And then talk about the enforcement data we're seeing and some other trends. So with that, we'll kick it off with some brief introductions. Again, my name is Aaron Gelb. I lead the firm's Midwest OSHA practice out of our Chicago office. I devote the majority of my practice to occupational safety and health here in Chicago, handling cases and inspections throughout Region 5. Particularly in Illinois, but also in all of our surrounding states. I've been pretty active inspection practice despite the pandemic. Some interesting experiences I'm always happy to talk about offline, including Zoom inspections and drone inspections and all manner of socially distanced and respirator-clad inspections with OSHA. Hopefully that'll be getting back to some semblance of normalcy. Want to find more out about me. I know you didn't log in for my bio. Obviously, you can check it out on our website, or I'm always happy to connect. But I'll let Amanda introduce herself, and then Dan, and then we'll dive right in.
Excellent. Thank you, Aaron. My name is Amanda Stranis-Walker, and I am joining you today from Atlanta, where I normally work and reside. I'm a partner in the Occupational Safety and Health Group and have been since the beginning of Con Maciel back in 2014. Prior to that, I got my start with OSHA law at the Department of Labor, working both at the front office of OSHA and then over in the solicitor's office. And since over 10 years, have been out helping clients navigate OSHA issues, whether it be employers or trade associations or other coalitions, through the rulemaking process, inspections, or the litigation process if we need to contest citations and can't find a settlement resolution. I also work with other agencies that have a high focus on occupational safety and health, such as CSB, incident investigations, RMP under EPA, and MSHA, and occasionally we get involved with DOJ cases, but we try to prevent our clients from having to deal with those. That usually means that criminal charges are forthcoming, or there's a criminal investigation that's part of an occupational safety and health incident. And that is a few details about me, and I will turn it over to Dan.
Thank you, Amanda. My name is Dan Deacon. I'm the final presenter of the group here, this panel. I'm an associate at Con Maciel Carey. I'm based in our Washington, D.C. office, and I work in both the OSHA practice group and the labor and employment group. And over the past year and some change or so, my practice has largely been focused on a lot of COVID-19 issues. And throughout that year and some change, I've handled numerous COVID inspections, responding to employee complaints and notices of alleged hazards, and drafting exposure control plans for employees, coming up with workplace safety and health policies to assist them throughout the COVID-19 pandemic. And I've handled the full range of litigation with citations and notice of contest, with a lot of focus in Virginia, one of the state plans that has been largely active, and one of the first, actually the first state to implement an emergency rule. So with that, I'll turn it back over to Aaron. He'll go over the agenda for today's presentation, and we'll dive right in.
Thanks, Dan. And just to give you all that brief overview, Amanda's going to start with an overview of the organizational updates at the Department of Labor under the Biden-Harris administration, talking about sharing our perspectives on some of these appointments or nominations, confirmations, what we can expect or anticipate seeing as a result of those. Then Dan's going to talk about how OSHA has been generally handling the pandemic. I'll jump in and provide an update on enforcement initiatives focused on the NEP, and then we'll conclude with a brief overview of developments with respect to the emergency rulemaking process, where things stand, why we haven't seen an ETS as we had expected, and if and when we might expect to see one. So with that, Amanda, I'll let you kick it off.
Excellent, thank you. So starting with our agenda of organizational updates at DOL. Well, there's been quite a few of them in the recent days, and starting at the highest level, the highest ranking official at the Department of Labor, there is a new Secretary of Labor. He was nominated by President Biden shortly after he took office in January, and he's already had his Senate confirmation and is currently working out of the Department of Labor in Washington, D.C., 200 Constitution Avenue Northwest. Immediately prior to taking that seat in DC, he was the mayor of Boston. He had, I'm not sure how long he had been in that post, but for a little while. And prior to that, he had experience with unions and had also served in the House of Representatives. He has a very strong union background. He started with regards to the Labor's Local 223 in Boston and earned a position as the head of the Building and Construction Trade Council, which certainly helped boost his political career in the Boston area. When he was there, he was very interested in developing high quality programs and getting increasing diversity in the workplace and providing career opportunities for women and other underrepresented demographics. Some of the things based on his prior experience with these elected positions to kind of might give us some indication of how it might impact his leadership role at the Department of Labor with regards to OSHA. He had very strong regulations. We saw in the city of Boston, they were very proactive with regards to their COVID policies, trying to limit the spread of the virus. And there was certainly requirements for face coverings, social distancing, building capacity limits, staggered work shifts, and worksite ventilation improvements. So very proactive city. He was leading the charge there at the time that we saw those activities go into place. We also have heard that he is known for somebody who's willing to listen to all sides, somebody who is open to compromise, takes notes, and forged good working relationships with the business community and has carved out a reputation as a pragmatist. So that is what we know about him. And he is relatively new. I think he might have been in office for about a month or so. So he is at Department of Labor. And the next person we're going to talk about is the highest ranking person at OSHA. This is a vacancy that he would be filling a vacancy that has been empty since the Assistant Secretary of OSHA under the Obama administration, David Michaels, left the post. During the entire Trump administration, we did not see anyone confirmed to that position. So this is an opportunity to have somebody, a assistant secretary, a official confirmed, Senate confirmed assistant secretary at OSHA. This nomination came out about a week or two ago, and it is Doug Parker. He is currently the leading person at California's Division of Occupational Safety and Health, where he's been for approximately 2 years. He knows his way around the Department of Labor, having served as a Deputy Assistant Secretary and a Senior Policy Advisor at MSHA during the Obama administration. And he's also got a strong union background. He started after law school at the University of Virginia, working at several union side law firms, or at least one of them, and then also working for the United Miners. Immediately after leaving the Obama administration, he took a job as executive director at an advocacy organization in California. And then when the current governor of California came in, he was put into place as the head of Cal OSHA. Since he's been at Cal OSHA, it's been a pretty active time for the agency. Cal OSHA is one of the few state plan states that has implemented a COVID ETS and other rulemakings, and they're certainly enforcing those. And some of the things that we hear about Parker, we'll see he has not had his Senate confirmation, and it is currently not scheduled at this point. So we're looking at least a month, maybe more, for him to be in office, assuming that his nomination goes through the Senate. But some of the things we should be prepared for as we look for his term as Assistant Secretary of OSHA is more aggressive policies, the potential for new federal standards, and maybe the return of some Obama-era rules, such as their interest in the anti-retaliation rule that came out as a memorandum in 2016. So that he is currently nominated and waiting to take his seat at the Department of Labor in Washington, D.C. He's got to go through his Senate confirmation. The other person who was a political who's been installed at the Department of Labor since the first day, Obama, since Biden took administration, and that is Jim Frederick. He, I think, was sworn into his capacity the same day that Biden was, 1/20/21 in the afternoon, and was in the door. He comes also from a union background. He had spent 25 years as the #2 individual at the EHS department at the United Steelworkers Union, and had more recently been out consulting with ORCHSE and the National Safety Council. He has in the office and has been there since the beginning of the Biden administration. He did not have to go through a Senate confirmation, so that's why they could get him in the door so quickly. He has been involved with this administration's decision with regards to the COVID-19 ETS provisions, as well as other guidance documents. The other thing that I thought was interesting in looking through some of the current developments that have happened at OSHA, there's also two other names that we don't have here on slides that have also been installed as part of the Biden administration since January of 2021. It's a new position. The title is Deputy Assistant Secretary for Pandemic and Emergency Response, and there's an individual filling that role. His name is Joseph Hughes, and was also appointed by Biden and did not have to go through Senate confirmation, so he was able to join the administration pretty early, and he's certainly taking a big part in the agency's response to COVID-19. There's also a chief of staff, Leah Fox, comes from a union background. Her immediate previous employer was the International Brotherhood of Teamsters, and she was installed around the March timeframe. So right now we currently have 4 politicals at OSHA. Well, actually, I'm sorry. Let me take that back. We have 3 in the door currently and 1 nominated. So the potential of 4 politicals at OSHA within the first 4 months of the administration. Certainly, this administration is moving at a much faster rate, which shows their level of interest in OSHA than we saw in the previous administration. Throughout the entire 4 years of the Trump administration, there was only 2 politicals there, and that took at least 6 months to get somebody in the door for the first one, and then maybe 2 years to get somebody in the door the second one. So seeing a much stronger interest put on OSHA than the prior administration. And I also think it's interesting, as I was looking through the DOL website earlier today, that it seems like OSHA might be one of the agencies residing at DOL that might currently have the most political appointees in the door, which is interesting and telling as to the focus and interest that we're anticipating that this administration will put on occupational safety and health. Going to the next slide. One of the other components of the occupational safety and health realm is OSHRC. This is the Occupational Safety and Health Review Commission. This is where if you have a set of citations that are under contest, they're going to be overseen by an administrative law judge that is at OSHA. And if you have a hearing and you don't like the result of that hearing, you can appeal to have it heard by the commissioners. There are 3 commission spots, and currently 2 of those are occupied. One of them just recently, their term expired, and so there is a vacancy. Of the 2 remaining, we have one that's pretty progressive, has served a number of years on the commission, and I think was first appointed by Obama. And she might actually be on her 3rd term, but she's been there for a number of years and had done a variety of government-related jobs. At one time, she was the highest-ranking attorney at DOL for occupational safety and health. And then the second one, Amanda Lyho, came from a trade organization before being Jim Sullivan's assistant, I believe the Manufacturers Association, and her term expires on April 2023. When we had 2 conservative judges or commissioners there on the commission, we were seeing very employer-friendly decisions, guarding cases, the limit of repeat violations and such. More likely to see a stalemate now between the 2 judges. And it has been the historical precedent that the president in the White House gets to have 2 of the commission seats. So the current vacancy is likely to be filled by somebody more of the mind of Cynthia Atwood, more union focused. That nomination has not happened this time, but it is on the horizon. And I'm going to turn it back over to my colleagues.
Thank you, Amanda. All right, this is Dan Deacon now, and we're going to get into OSHA's approach to COVID-19. And we're going to start basically a year ago under the Trump administration, and we're going to travel up into the present time and kind of see how things have changed and what's going on right now and what we can kind of anticipate in the future going forward. So beginning first with Trump response to COVID-19, dating back right to March 2020, February, March 2020. So generally what we're looking at is there was a lot of interim enforcement guidance memos that were published, but the big elephant in the room, right, was that there was no emergency temporary standard that was promulgated. I think it was back in May of 2020, there was a petition filed by the labor groups to force OSHA to promulgate an ETS, and that was defended. They said that they were not going to issue one, and it was unnecessary at the time. Secretary Scalia defended that, saying, right, it was unnecessary. So throughout that, the next 8 months or so that the Trump administration was still in office, no movement was made on an emergency temporary standard. What they did though, right, they issued several interim enforcement memos and kind of outlined some additional guidance of how employers should handle and respond to the pandemic and how to protect workers. So there was a number of different memos that were related to enforcement discretion, some leeway in terms of satisfying some particular regulations, for example, fit tests, respirator fit tests, the annual fit tests that need to be performed, annual audiograms. So there was some leeway in enforcement discretion related to that. As far as enforcement of COVID-19 issues, it was focused mostly on very high risk level industries, such as healthcare industries, hospitals, and the like, and some of those other high risk level workplaces, for example, meatpacking industries. And we're going to go over some of the statistics in the next couple slides here, just to show you the kind of general enforcement big picture as it relates to those high risk level industries versus your typical general industry workplaces. And most of those inspections, especially the in-person inspections, were focused on COVID-19 fatalities and imminent danger situations. So that's when OSHA was coming in to the workplace to really actively enforce COVID-19 issues. But most of the time, what we saw were these notice of alleged hazards, the complaint letters, and RRI investigations. And that was basically the status quo of how these inspections went for most employers. Again, the only time we really saw OSHA coming into the workplace was in those really high risk, imminent danger situations, or where there was significant outbreaks, or again, COVID-19 fatalities. So the bottom of the screen here, you see what the inspections look like up until, or I should say complaints, up through January 20th, 2021. And if you compiled all the state and federal complaints that were received, we're looking at close to 55,000. The 55,000 complaints in the span of 8-9 months or so, that is a lot, significant. And as you can imagine, given the limited resources that the agency has, it was almost impossible to kind of follow up on each of those and handle the inspections in a normal process. Hence why we got the notice of alleged hazard letters and the RRI requests. And that was really the way that OSHA began responding to COVID-19 issues and those hazards in the workplace. So again, just quickly going over the enforcement kind of statistics under the Trump administration. There were over 1,500 federal OSHA inspections. So that's just in the Fed OSHA jurisdictions, not including state plan states. 300 plus establishments were cited for COVID-19 related issues. So on the next screen, you're going to see what the major regulations that were cited, a lot of them having to do with respiratory protection. And then also there's, of course, the use of the general duty clause in many instances. And throughout the course of the 9 months or so we're talking about under the Trump administration, there was over $4 million in penalties that were issued. And the typical penalty for one of these citations, single item citations, ranged from about $13,000 to $15,000. So here on the screen, you see the standards that were cited in COVID-19 inspections. And this is something that I'm sure many of you are pretty familiar with. The big primary kind of focus was on respiratory protection. So you see the first three on the screen there, the top three standards that were cited had to do with respirator fit testing, the medical evaluations, and a written respiratory protection program. And then following that, we get into the fatality reporting issues and the record keeping for your 300 logs. And then it whittles down to PPE, respirator selection, bloodborne pathogens issues, and then the general duty clause as well. And we have some other outliers with respect to hazard communication and some other minor record keeping issues. So interestingly, what we saw in terms of contesting COVID-19 citations was pretty staggering and quite interesting, right? So employers typically only contest about 8% of all OSHA citations, but what we've seen over the past 9 months, a year or so, has been employers contesting 42% of all COVID-related citations. So out of the 408 citations that were issued through April 12th, 2021, just a little over a week ago, 172 of those were contested. So that's a significantly steep increase in kind of the decision-making that employers are making in contesting OSHA citations. And there's, pretty good reasons for that. And we'll talk about those in just a second. But 85% of all those contested cases actually involve healthcare employers. So again, I mentioned earlier that the primary focus in a lot of the big inspections were focused on those healthcare employers, hospitals, and the like. And another 5% involve food manufacturers. So that really leaves 10% for the rest of the general industry, warehouses, other manufacturers. So really it was highly focused on those high-risk workplaces. So getting into why you should appeal and why a lot of employers are contesting these COVID-19 citations. Well, there's quite a few reasons. And first being reputational harm. OSHA still is issuing press releases, and oftentimes employers might find themselves, especially in significant cases, in the news with a bad press release issued by OSHA. And that is significant reputational harm if you're being blasted all over the news for being, what OSHA might characterize as a bad actor, right? So there is a lot of incentive for employers to contest those and clear the record, ensure that the public knows that they are doing everything in their power to combat COVID-19 in the workplace and provide strong programs for their employees. There's also the impact on civil lawsuits. That was an increase in civil lawsuits related to pandemic hospitalizations and fatalities, which is still ongoing. And there is an incentive for employers to make sure that they defend these OSHA citations so they don't become an issue in any pending civil lawsuits. And of course, as with any other citation, non-COVID related citations, there's always the potential for repeat, even beyond the pandemic moving forward. If everything gets back to some semblance of normal in the near future, there is still the potential for repeat under a myriad of those citations that have been issued, right? Respiratory protection, that's just not applicable to the pandemic, right? If you're a workplace that typically relies on respiratory protection, even during non-pandemic times, there's of course the risk for a repeat there. And then finally, there's the big question of whether OSHA can sustain its burden. And a lot of times there we're talking about general duty clause citations, and whether OSHA can prove that there's a feasible means of abatement, perhaps, that would substantially reduce the hazard. So there is incentive as well to defend these citations on the merits, and employers are being aggressive in their stance on that, and a lot of times have been successful. So now we get into January 2021, and we're transitioning into the Biden administration. So what happens then? Well, in the first full day of office, Biden issued an executive order on protecting worker health and safety. And what that did was it directed OSHA to revisit its COVID-19 strategy in 4 specific ways. First, by February 4th, OSHA was required to consult with the CDC and other agencies to update its COVID-19 guidance based on best science, and that has been done. I think the guidance was issued January 29th, 2021, and that is posted on OSHA's website. And it's about 2-3 pages and lists a myriad of different things that we're going to go over on the next slide. 2, OSHA was required to enhance the COVID-19 enforcement efforts, right? So the COVID-19 relief bill allocated $100 million+ for OSHA to focus on enforcement. So we're expecting an increase in that over the Biden administration, and we've already begun to see that. 3, they're required to launch a COVID-19 national emphasis program. And then 4, one of the big topics that we're going to be talking about later in the presentation today is to consider whether an emergency temporary standard is needed. And when OSHA does conclude this, it's not a question of if, it needed to be issued by March 15th. And obviously we are well past that. We're over a month past that. We still don't have an emergency temporary standard. And there's a lot of questions surrounding that. Why hasn't it been issued? And really, what is going on at OSHA as it relates to this ETS? When it will be issued, if it will be issued, what's the current status? So I mentioned that OSHA did update its COVID-19 guidance issued late January 29th, 2021. And here we're just going to go over kind of the highlights of that and really what you should be making sure that you're implementing in your workplace and dotting your I's, crossing your T's, checking all these boxes so you don't get in trouble if Fed OSHA does come knocking at your door. So you need to implement a written COVID-19 prevention program. That should be, and we recommend a written COVID-19 prevention program, of course. And what it really needs to do is include the following elements. First, you want to have a hazard assessment that reviews where and how employees may be exposed to COVID-19. A lot of times we have seen in other contexts, right, in the Virginia rule, there's different risk categories. So you have low risk, medium risk, high risk, very high risk, depending on a variety of different employees involved in performing those tasks. And you kind of establish the risk level that employees are exposed to. 2, you're going to identify a combination of measures to limit the spread of COVID-19, and those include your, safe work practices, your administrative controls, any engineering controls that you are going to implement. And I'm sorry, I'm seeing some messages that my sound's going in and out. I apologize for that. I'm not sure if it's an internet issue or what, but I'll do my best here. I'm almost done, so just bear with me. 3rd, you want to adopt measures to remove infected or potentially infected workers from the workplace. So that's really a response plan. Make sure that you have measures in place where employees know where to communicate. If they do have a close contact or they are diagnosed with COVID-19, what are those response measures, including the disinfecting and cleaning protocols that you want to have in place. Make sure you're training workers on COVID-19 protocols and the hazards associated with the workplace in a language they understand. There is a specific requirement to assign a COVID-19 workplace coordinator. You want to implement CDC and OSHA guidance on improving workplace ventilation, make vaccinations available at no cost to employees, ensure vaccinated employees continue following control measures, and of course, an anti-retaliation provision, making sure that you do not retaliate against workers who raise COVID-19 related concerns. With that, I'll turn it over to Aaron, and he'll go over some additional OSHA COVID-19 enforcement.
Thank you, Dan. And that's a perfect transition point. One of the reasons why we believe it's so important to kind of take that inventory of your current pandemic response, conducting the assessments and developing that written plan is in the event, as Dan said, OSHA shows up at one of your work sites to conduct an inspection. Those are the sorts of things that they're going to be looking at. And we'll talk about the types of inspections that we've seen, or the citations, I should say, that we've seen issued by the agency. There have been a handful of ones that are, I think, particularly noteworthy. But we're going to begin, I think, moving to the next slide by talking about COVID's NEP, or the OSHA NEP, which is the National Emphasis Program. And it's really no surprise that the agency issued, certainly as Dan covered in the day one executive order, this was something that was signaled as an action to be taken by the agency. I think that this only surprise for us is that there wasn't some sort of initiative like this during the prior administration. In the absence of an emergency temporary standard, ramping up enforcement or inspections would be the logical alternative to that. So even without the ETS that we're still waiting on, know that OSHA is focused on conducting inspections, programmed or targeted inspections. And remember that that's what an emphasis program is. It means that the agency is going to be targeting those employers, and it's set forth right in the abstract. It would be the companies or the employers that put the largest numbers of workers at serious risk of contracting the virus. So that could really be one of two things: that the employers that are putting workers at the greatest risk, which would be obviously healthcare, as well as those employers that are putting the largest number of employees at risk. And I think what's also notable in the NEP is that it right in the main part of it, in the meat of it, is this focus on retaliation. And that, I think that is a theme that we're going to see throughout the Department of Labor and the current administration in general, and OSHA in particular, in that we saw this also during the Obama-Biden administration with Patricia Smith, who was then the head solicitor at the Department of Labor. And that is this concern that is intertwined, if you will, with the general efforts to enforce whatever the laws are, whether they're wage and hour, whether they're workplace safety and health. The concern that employees are going to be dissuaded or discouraged from coming forward with their complaints, with their concerns, whether it's about a wage practice or, in this case, an employer's inadequate response to the pandemic. I saw a question that came up that I'll address while covering these slides. Why an ETS or why an NEP without the ETS? I think in a way it's probably more, it makes sense or less surprising to see an NEP without an ETS than to see an ETS without an NEP. We OSHA lawyers certainly like to use acronyms, and so as you can tell from this and any other probably presentation we give. But the point is that the NEP is getting OSHA into workplaces to conduct these inspections. In my view, I think OSHA is taking the view that, look, we've been giving you guidance for the past year. We issued guidance early in the pandemic in March. We've then issued various industry folks guidance documents. We've updated that guidance this year under the new administration. We've been issuing citations that include and identify what the feasible means of abatement are. And so that is the roadmap that you employers need to follow. So I think that they have enough out there to do inspections and do enforcement and issue citations without the ETS. Now, obviously, the ETS makes it a lot easier for them to issue and sustain those citations. As Dan said, general duty clause citations can and historically have been very difficult or more difficult for OSHA to win than if there is a specific standard that says you must have a written program, you must do training, you must conduct pre-shift screenings. That is very prescriptive, and if you don't do it, that's in my view akin to not having fixed wiring or using an extension cord when fixed wiring is required. It's not very difficult for OSHA to prove its case. It's much more difficult to prove a general duty clause violation. So I think that's why we're seeing the NEP, even though there is no ETS yet. Important to note that the emphasis program is effective now. It was effective when it came out. Quite often, emphasis programs have some sort of introductory period where OSHA is getting out into the community and educating the regulated community about its requirements. That's not the case here. And again, I think that is in part because we're already a year into the pandemic with all this guidance already being out there. In addition to the emphasis program, OSHA has issued a new Interim Enforcement Response Plan, which basically, and we published a blog on this, but one of the key takeaways is that there are going to be more on-site inspections conducted. For the past year, I think it's been pretty convenient for many of us because we're just doing these witness interviews and inspections by Teams or Zoom or WebEx or whatever platform you're using. I think in the end, some employers found it pretty convenient that OSHA wasn't actually walking through the workplace, and now they're going to be back. I know from several of the conversations I've had with area directors, their co-shows are now fully vaccinated or will soon be fully vaccinated. So I certainly expect a return to that normalcy in terms of in-person inspections. So moving on to the next slide. What OSHA is going to do, and I said this at the top of this section, an emphasis program is about targeting. So OSHA is going to be developed 3 target lists for establishments to be inspected under the NEP. One would be high-risk healthcare establishments. So that those are going to be particularly establishments that are caring for COVID patients, establishments that are performing the types of procedures that result in the risk of increased exposure to respiratory secretions or airborne infections. But then a second list, which is for high-risk non-healthcare establishments. And like any emphasis program, it's largely it's going to be based on NAICS codes. So OSHA has determined, and has published this list. It's included as an appendix to the NEP. Includes industries like warehousing, storage, obviously, as well as grocery and certain other retail stores. Locations or workplaces, obviously, where employees are either expected to generally be working in close proximity to each other, as well as to members of the public. And then the third list, it was non-healthcare, but critical infrastructure industries as well. So as far as I think a couple of other factors or aspects of the NEP that are noteworthy is that if you were inspected, and a number of clients of mine that come to mind, and concluded that COVID inspection with a clean bill of health, no citations were issued, you may well be selected for a follow-up visit. And I think one of the reasons for that is based on some conversations that I've had with inspectors during the co-shows during those inspections, that there was a pretty involved review process, meaning that whatever the area office was inclined or wanted to do, they then had to run it by the regional office. And the regional office then had to run it through OSHA's national office, which was where the political levers were being pulled. And whether that was one of the reasons why you saw so few citations for the meatpacking industry, or you saw no willful violations being issued. The sense that I got, it wasn't said directly to me, but the sense that I got from certain inspectors at OSHA was that their hands were tied, or their ability to issue citations was limited. And so what we saw in a few inspections was there were no general duty clause citations issued, but the area office would issue a hazard alert letter stating, and I saw a few that had some assertions or some contentions that I thought were a bit overreaching, and I certainly disagreed with. OSHA required a response to that letter indicating what the employer was going to do about the alleged COVID hazards that were identified but not cited. So if you received a hazard alert letter in response to an inspection but no citations, I would be very mindful or concerned that OSHA under this NEP will come back and re-inspect your workplace, either to confirm that you did what you said you did in your response, or just to verify that you're still doing what they think you're supposed to be doing. As I said on the prior slide, retaliation will continue to be a focus, and those inspections or allegations will be addressed through OSHA's whistleblower unit. The NEP this is again a federal initiative, or federal OSHA initiative. It is encouraged that state plan states, such as Dan referenced, working in Virginia, here in Illinois, we're bordered by Iowa, which is a state plan state, and to our west, and Indiana to our east. Whether or not those agencies do issue or adopt the NEPs remains to be seen. I think a number of states will, and I suspect by the same token, a number of states will not. Another factor for any of you all that might be particularly smaller employers, there is no size limit or threshold for this NEP. It applies even to those smaller employers with 10 or fewer employees. So moving on then to the next slide. The current plan in the document in the NEP itself is that it will remain in place for 12 months. But like many things, OSHA reserves the right to extend it, which I think we can all agree is something that we hope is not necessary, because that would mean that we're still not out of the woods come early 2022. And for those of us that are doing webinars from our basements or bedroom offices, I'm sure many of us would like to see that come to an end. But at the same time, we can all keep our fingers crossed. There's always the possibility that the NEP will be canceled sooner than 12 months because the CDC has declared an end to the pandemic. As far as overall number of inspections, you can see in the next bullet point, the NEP calls for using at least 5% of OSHA's resources, meaning approximately 1,600 or so inspections. So obviously, given the number of work sites in this country, that means your odds are still relatively low. But for those clients of ours and that are subject to COVID inspections, that doesn't make you feel any better. I'm going through one COVID inspection right now that for an employer that I think has done an absolutely fantastic job responding to the pandemic, and OSHA is conducting that inspection with resources and witness interviews that I typically only see in significant catastrophe cases. So, again, so much of it kind of depends on the area office and what their priorities are and such. So, number of inspections is percentage-wise is relatively small, but I expect them to be intensive and very detailed inspections. So another thing to consider, if your site, if one or more of your work sites also finds itself on OSHA's site-specific targeting list, which is another program or emphasis targeted inspection program, which is based on largely your DART rates. OSHA expanded the SST program to include other qualifying criteria, such as a trending increase in DART rate over a 3-year period. If you find yourself on both lists, you could end up in a situation where OSHA is not only doing an inspection of your COVID practices, but then expands it into a wall-to-wall SST inspection, which can be quite invasive and time-consuming, and depending on your workplace, result in a significant number of citations, because OSHA has the ability to look at every program, every aspect of your workplace. Also keep in mind, and I think this is one area where we've seen with COVID in particular, that area offices can add establishments based on what it refers to as local knowledge, or even health department referrals or media. So we had one client here in Illinois where OSHA opened the COVID inspection simply based on news reports on the local television station about an outbreak at their work site. So if you find yourself in the media due to some COVID-related issue at your site, there's OSHA watches TV too, and so there's a good chance that they will open an inspection. We saw that with COVID fatalities as well, when the news media, for whatever reason, picked up on a COVID fatality, that OSHA would, out of the blue, make a phone call to the employer and begin asking questions about that fatality. So moving on to the next slide then. I mentioned earlier a couple of noteworthy citations. Just earlier this month, OSHA issued the very first willful COVID citation under the General Duty Clause. Interestingly enough, this was an inspection that was opened on March 17th in Lynn, Massachusetts, of Liberty Tax Services. OSHA issued the inspection, I think, in just around 3 weeks. And if you recall, Lauren Sweat, who was essentially the head of OSHA during the Trump administration, given the fact, as Amanda noted, that there was never an assistant secretary of OSHA, the Sweat made the point that one of the reasons, 3-4 months into the pandemic, that there had been no COVID citations issued yet, was that OSHA really was taking the time to build strong cases under the General Duty Clause, and that you wouldn't see a rapid turnaround or rapid conclusion from opening to citation issuance. So this case clearly, I guess, rebuts that argument, or really shows that OSHA can move quickly when it finds alleged hazards or situations that it believes are problematic. This is an interesting case, and I certainly assume that is an extreme outlier. If you read the citation and both read the citation and read between the lines, I think we can all see why this was issued so quickly and why it was issued as a willful violation. So this employer essentially was forbidding, actively preventing its employees from wearing masks, forbidding customers or clients from wearing masks. There were no barriers installed. There was apparently no changes to cleaning practices. There was no social distancing. There was no pre-shift screening. No changes to the ventilation system. As best as I understand it, the owner of this tax preparation service is essentially a COVID denier, or believes this is all a hoax, and so conducted herself and her business in a manner according to that belief. So it doesn't surprise me. We're not talking about an employer that's not requiring masks, but we're talking about one that's requiring people not to wear masks. And when you combine that with the lack of social distancing and the lack of barriers, in essence, there were at least according to OSHA, and again, this is all OSHA's allegations, that there were no protections in place. So I think that's why we see a willful violation, and that's why we see it issued so quickly in ways, if you're sort of analogous to construction industry citations. When OSHA sees workers in a trench that's not shored up or on a roof without fall protection, they move quickly, issue those citations right away. So moving to the next slide, then a little bit, what I thought was interesting, more so than the facts, other than the facts I think are again such an outlier, is OSHA listed 12 means of feasible abatement, because really that's in many cases, if you think about a general duty clause citation, where those citations are won and lost for employers is first in the hazard recognition side, which I haven't really talked about yet. I mean, I think I think everyone, certainly OSHA, recognize there's difficult, or not impossible, for an employer to argue that COVID is not a recognized hazard. Save the discussion for another day, as I believe the head of North Carolina OSHA made an argument in a letter that she had written in response to some questions about how North Carolina OSHA was conducting itself. She raised the question of whether the agency could satisfy another element of the general duty clause, which is if the recognized hazard is sufficiently dangerous that it poses a serious risk of harm or serious illness or death. Given the serious outcomes or the fatalities, I don't think anyone would argue that COVID, or most people would argue that COVID exists or that you could get very sick from it. But given the fatality rates and the hospitalization rates, apparently this individual at North Carolina OSHA is questioning whether that element or prong of the general duty clause citation could be satisfied. I've not seen that argument made anywhere else. I'll just say that it's an interesting one. I would not be confident to hang my hat on it, however, but I'd be happy to just discuss that offline, and because I think it's an interesting issue. It's a I don't know, maybe not even interesting issue. It would be a pretty bold approach to take. I think again, really, it's going to boil down to the feasibility of abatement in these citations, and that's why, again, tying back to what Dan was talking about, if you can do make a solid effort to complete all of the steps, or as many of the required elements or suggested elements, I should say, in OSHA's guidance, I think that's how you win. Obviously, it has the probably more important benefit of protecting your employees and reducing the risk of COVID transmissions. But any employer that is inclined to try to win these by arguing that either COVID's not a recognized hazard or it's not a serious hazard, I wouldn't recommend that course. I think it'd be a tough hill to climb. I'm sure someone will make that argument, and it'll be interesting to see how it plays out. But so back to the feasible means of abatement. again, almost tracking, I think, what Dan covered. So what OSHA recommended or said that Liberty could have but did not do to protect its employees is conduct a hazard assessment and develop an exposure control plan, use barriers and partitions. And then I think this is important wherever distancing is not feasible. So as a primary method is separate your people, move them if possible, have them working at least 6 feet apart. And when that's not feasible, then explore the use of barriers. Look at other engineering controls to improve ventilation. So we have some clients that have enhanced their ventilation systems, that have installed MERV 13 filters or taken other steps that are recommended by ASHRAE. I've seen a number of instances where in those cases where employees cannot be working in at least 6 feet apart, that the employer will purchase and use portable standalone HEPA filtration systems in those rooms as a means of feasible means of abatement. Already talked about both establishing and enforcing social distancing. So for an entity like Liberty, Liberty Tax Services, OSHA recommends call ahead service, pick up, curbside drop off, something that we've seen with a number of our veterinary and other kind of outpatient medical service clients. A number of these are very basic training, again, as Dan said, in a language that employees understand and in a means that they can understand it as well, meaning not overly complicated depending on your workforce. Enhancing, expanding your cleaning and sanitation efforts using the chemicals on EPA's list N. Although in light of the CDC's recent guidance on cleaning, that's likely to change as well. Facilitating hand washing and providing a sufficient supply of hand sanitizer to employees, instructing sick employees to stay home, then conducting contact tracing if someone does test positive, and then last but not least, following state and local mandates, which sounds easy enough to say for us, but we recognize for those of you that have operations in various states, that it's that patchwork that has really been a challenge for many employers, keeping track not only of the state laws as well as the local city or county mandates, health department rules. I did see a question that came in about asking which states have adopted emergency temporary standards. So I'll address that real quickly. As Dan noted, Virginia was the first in line, issuing their ETS last year, I think towards the middle of the year, followed by, I forget the exact order, but I believe it was Michigan OSHA, then Oregon, then California. And then we've seen other states through executive orders and rules that have adopted and promulgated certain requirements. So Washington OSHA has made, in the state of Washington, promulgated a number of requirements. Minnesota OSHA has various requirements that include the development of an exposure control plan. So that's something also that we're happy to discuss if anybody has further questions offline. So then I'll move on and cover just one other citation of interest. Earlier, a couple months ago, I think in February, OSHA issued another general duty clause citation to Peterson Manufacturing after a COVID-19 fatality. That was a serious general duty clause, not willful. In the citation, the agency called out 2 instances in both cases that involved 2 employees who were working in close proximity on machines that required more than 1 operator. And really the nub or the key here was that the employer had people working throughout the day, less than 6 feet apart, and did not mandate the use of masks. So I think I also saw a question a little bit earlier asking, what do we do if we are in a state or a county where the mask mandate has either expired or been rescinded by local or state government? OSHA's, and this is one of the things that I think is going to present a real challenge. So if you're in a state like Texas, which Governor Abbott made a big show of rescinding the mask mandate, it puts employers in a difficult position. Texas is a federal OSHA state. So there's nothing in, at least in most, I haven't yet seen a state that prevents employers from requiring masks of their employees, and nor am I aware of any that prevent employer or business owners from requiring guests to their business to wear a mask. But obviously it sets up this difficult scenario where your employees are going to be saying, well, I'm not required to wear a mask when I leave the workplace. Why do I have to wear it here? I think that should be a generally pretty easy answer for most employers. And there are a lot of rules that apply in the workplace that don't apply when they leave. I think the bigger issue is for those of you that are public facing, it's going to be that much harder for you to enforce the mask mandate that you're attempting, if that is something you so choose to do. If you're in retail and it's not a requirement, but you still want to impose that, you're going to get probably far greater number of customers that are coming in and refusing to wear a mask, which then puts your employees in the difficult position of attempting to enforce a company rule as opposed to a state mandate. So in the Peterson manufacturing case, unlike Liberty Tax Services, OSHA really just identified 4 primary means or feasible means of abatement: implementing and enforcing the use of face covering, establishing and enforcing social distancing, training employees, and then potentially implementing protective measures such as barriers. So again, when you look at the citation, this was, as I said before, employees working close together on multi-operator machines. I would hope that this citation like this would not have been issued if the employer had simply been requiring masks and requiring distancing where feasible. I would imagine, I haven't seen these machines, but based on my experience, I think many pieces of equipment, machines that are used in manufacturing facilities don't lend themselves to additional plexiglass barriers. And in fact, those barriers could create a greater hazard. And what I would recommend there is show that you've assessed that. We looked at this machine. We can't have these employees working farther apart than they already do. We considered the use of plexiglass barriers, but that would create a greater hazard, or it's not feasible for this reason or that reason. And that's why we're going this route that we are, but we are requiring masks, we are requiring sanitation, we are doing pre-shift screening, et cetera. I think if you do those things, it's much harder for OSHA to sustain a general duty clause violation than if you can't show that kind of thoughtful process. So I think that is that, I believe next slide is, yep, that's Dan. I think I'll turn it back to you then.
Yeah, so we have just a couple more slides here. Hopefully we'll get you out in 5 minutes or so. I know we went a little bit over time, but we had some important topics to cover, and happy that a lot of you have stayed on. I see our attendee list is still high. So we're going to go over the status of OSHA's COVID-19 emergency rulemaking now, and kind of what to expect, or what we thought we had expected, right? So without getting into too much detail of the administrative process and how rulemaking goes about, this is an emergency rulemaking, so there is no formal pre-rule public and notice comment period. So that differs. The emergency tag makes that a little different from the traditional administrative process when they go through a rulemaking notice and comment period, and then finally rolling that out to OMB and promulgating the final rule. So the rule does still need to be submitted to the Office of Management and Budget for approval, and there should be some period for stakeholder input under Executive Order 12866, although that is going to be some proactive stakeholder input. It's not going to be your traditional public notice comment period, like I said. And as of today, still OMB's website does not reflect a docket entry for the COVID-19 emergency temporary standard. So again, we're over a month past the deadline when that was supposed to be rolled out, right? The deadline was March 15th, 2021, and here we are, April 20th, 2021, and we still don't have any docket entry, any sign of when that rule is supposed to be implemented or rolled out. So what's the likely timeline then? What are we looking at? Well, OMB is going to technically have 90 days to review and approve the rule or return it to OSHA for more work. That's, again, once it gets to OMB. That timeline is non-binding, and in practice, OMB can take a little less than a week to several months to review and get that feedback on the rule. So since this is an emergency rule, we understand that OSHA has been coordinating with OMB throughout the process. So it's anticipated that it will be moved through fairly quickly once it makes its way to OMB. There, again, should be some minor period for stakeholder input, some proactive stakeholder input, even if that is without a preview of any actual regulatory text or a proposed rule itself. So right now it's really just unclear at what point when the rule is going to be issued and rolled out. It'd be great if we had more of a deadline or some transparency from OSHA as to what the timeline really looks like, but at this point, we just aren't sure. Given that Doug Parker is coming into OSHA and being a former head over at Cal OSHA, it is anticipated that this is going to be something that is a priority and rolled out soon. But timeline, again, it's a big question mark. There was some interesting comments made a little over a week ago, I want to say it was, by Secretary Walsh. He requested a hold on the release of the OSHA ETS, but according to DOL spokesperson, and this was when he first came into the office, that hold was so that OSHA could make a rapid update based on the CDC analysis and latest information regarding the state of vaccinations and the variants. And then just over a week ago, or a couple weeks ago, in early April, he gave a public interview indicating that OSHA was evaluating whether it even needed to move forward with an OSHA standard. So that was the first time we ever heard that OSHA had perhaps put a pause on moving forward with the ETS and considering whether it was really even necessary. And as you can see on the screen here, the little quote that we have in highlights is the pertinent language there. Again, we're looking at where we are with the virus right now just to see forward with standard. We want to make sure that we get the most accurate information. So, that was the first time we heard OSHA kind of backtracking and backpedaling, so to speak, on its view of moving forward with this emergency temporary standard. But again, over the past couple of weeks, that there has been some additional changes, including Doug Parker being nominated and coming to the agency soon. And of course, Cal OSHA has probably the most robust COVID-19 standard that's more prescriptive than a lot of the others. So we anticipate that will be a priority and something that they're going to be moving forward with soon. So I'm going to turn it over to Aaron really quick, and he's going to go over some of the efforts that we've been undertaking to influence the emergency temporary standard.
Thanks, Dan. And like Dan said, I'll keep these remarks very brief and perhaps begin by referring you all to a post on our blog, the OSHA Defense Report, back on February 12th, when we provided, I think, a lot more detail as far as our efforts to influence the federal COVID ETS. But suffice to say that we formed a coalition of employers and trade groups across a variety of different industries, as you can see described here in the first bullet point. We were able to participate in a listening session that OSHA held with a number of stakeholders, in which we shared and discussed our top priorities, the concerns that our coalition members had with respect to the potential ETS. We then submitted comprehensive written comments along with our recommendations both to OSHA as well as OMB. And we've requested a stakeholder meeting as well with OIRA. Now, obviously, that comes right on the heels of Dan's cautionary remarks and review of Secretary Walsh's surprising statements. So you may be wondering, well, why would we need to or get involved in a coalition now? if this ETS is not going to happen, or if it's already fully baked and it's about to be issued. So one of the things that we're planning to do through this coalition is once the ETS, if and when it issues, to continue that advocacy and efforts to shape, or at least shape how it's, to the extent it's changed, which is something that we were able to do in California with the OSHA ETS that Dan's referenced. After by virtue of the process itself, emergency rules are pushed through or rushed through much more quickly than normal rulemaking. Obviously, a number of rules take years, in some cases decades, to promulgate and finalize. So here we're talking about something that happens in a matter of months or weeks. And so what's happening in California is the rule is out there, it's being enforced, but at the same time, there are meetings that are held, and we've secured a seat in one of those committees where we are representing a coalition of California employers as well, to provide input and feedback to OSHA about likely changes to certain aspects of the ETS. So we expect to do the same thing here again, if and when an ETS issues. And then on to the last slide, just a real brief highlight of a number of the categories or areas in which the recommendations that we made in our written comments to OSHA. Really, we've talked about a couple of these. I mean, one of which is include a grace period, meaning give employers time to comply with whatever's in there, as well as a sunset provision, meaning when it ends. We're fans of the Virginia approach, which includes really tying a lot of the standard to evolving CDC guidance, giving some flexibility and then also requiring the states to adopt the identical rules, so we don't have that patchwork of rules and requirements. A number of the other ones, deal with things like the voluntary use of N95s, providing greater flexibility as to the style of face coverings, conducting tiered hazard assessments with less rigor for lower risk workplaces, which ties to one of the questions that I did want to address that I saw came in, because I thought it was an important one, and hopefully one that if those of you that are still on might get some value out of, which was, what should our hazard assessment look like? Do we need to do an assessment of each job, or can we kind of group the jobs? And I would say absolutely. I mean, just like you can group lotto procedures for periodic inspections if they're similar, you don't have to do an assessment of each and every position. If you think about, one of the ways that I recommend going about it is look at, how can COVID spread in your workplace from person to person. And used to be the greater emphasis, or a similar emphasis, on how could it spread from surface to person. Obviously, we're learning, as we learn more and more about it, that seems to be far less likely means. Doesn't mean you ignore it entirely. So you look at the surfaces, you look at the interactions and the locations that work is done. So you might do an assessment of a particular department. You might do an assessment of a particular task. It could be that many of your workers have little to no exposure, and you just have one or two areas. And as I said, we have 4 machines where people work side by side. How do we protect them? And do your assessment of those things, those positions. If you're looking for a form for assessments, there are a number out there. Oregon OSHA, for example, as part of its standard, requires hazard assessments, and they created a form to use. That obviously, not saying that's the only form to use, but for one safety agency to put that out there, if you were to use that's a good approach, could be a good approach. And we're happy, if you want to reach out to us separately, we're happy to share some templates with you all. So that's all I had to cover. I think Dan and Amanda, I don't know if you all are able to stick around for a few more minutes. We can try to answer some of these questions. Let's see here. Where does the meatpacking industry fall into the NEP? I believe it is on the second of the 3 targeting lists, which would be the high hazard, or the industries where COVID is a particular hazard. So I do know that I forget it. I'm not sure if it's on the second or third list, but I know it's on one of those lists. So it is one of the industries that is in OSHA's crosshairs for sure, and employers in the meat packing, the slaughter, meat, animal, and meat processing industries are certainly likely to be inspected by OSHA in the near term under the NEP. Another question I see, if our county has dropped the mask mandate and our business is not healthcare critical industry with little risk, are our employees required to wear masks under the NEP? So not under the NEP. The NEP is really just a targeting program that identifies workplaces for inspection. What I would say though is consistent with OSHA's guidance throughout this pandemic, really from the very beginning, or at least once the CDC made the decision to recommend masks, that OSHA is taking the position that your employees should be wearing masks. Certainly if they are working within 6 feet of each other, that as you can see from the Peterson manufacturing case, that OSHA will likely cite or list the lack of a mask mandate for those employees as a basis for the violation, or conversely, that the one feasible means of abating the hazard posed by COVID-19 would be to require employees who are working within that 6 feet of separation to wear a mask. So not required by the NEP, and that, I think, really tying it back to the ETS, or the Emergency Temporary Standard, where I'm seeing, I think what we're expecting to see is potentially a mask mandate in the ETS. But that may also be one of the reasons why it's been delayed. It may be a political hot potato that has prompted some internal debate. I think when states like Texas, Mississippi, Alabama rescinded their mask mandates, I think there were some that thought that the Biden administration would use this ETS as a way to continue, in essence, create kind of a quasi-national mask mandate, at least in the federal OSHA states. But whether they have the stomach to do that remains to be seen. But that's certainly one of the, I think, things we will be most interested in looking for if and when the ETS issues, and we dig into it to see if there is a mask mandate in there. I think let's see, another question I see regarding record keeping. When CDC declares an end to the pandemic, will employers no longer have to record COVID cases on their log? That's a good question. I tend to think that I don't think that one is tied to the other. So even if we're no longer in a pandemic, COVID is, as long as people are still contracting COVID, it would be unless something in the ETS modifies OSHA's record keeping rule, then and treats COVID like the cold and flu, which we may get to in a couple of years, or a year or two from now. But for now, I don't expect that would take place. And if you have a COVID case or outbreak in your workplace, that through your work relatedness analysis you determine is work related, then you're going to need to put it on the log even when the pandemic is over.
I have one question related to the risk assessment and how you can perform that. So OSHA does have some guidance about the hazard assessments and how you can perform that, but generally what employers are doing is they're looking at each job position and evaluating the job tasks, what those workers typically do in that position, and evaluating whether they fall into that lower risk category, medium risk, high risk, or very high risk. And those are specifically spelled out by OSHA. For example, the lower exposure risk are those that don't require any close contact within 6 feet of anyone for 15 minutes or longer. So those are people that typically work in office settings or remote work is probably the largest bucket that we see, right? And that's jobs that require some frequent close contact with other individuals in areas with community transmission. So, folks in manufacturing settings, agriculture, construction, those types of industries. And then the high exposure and very high exposure, those are, close contact with known or suspected COVID-19 patients, healthcare settings.
Yep. Thanks, Dan. Yeah, and another kind of related to the assessment, another question that came in is our COVID prevention plans, the written programs that Dan and I talked about, are those effectively being required as part of mitigation at the Fed level and even the state level? I think that's you asked, the individual person who asked that question, I think really hit on the head. It's not legally required, meaning that if you don't have one, that's a violation, which could be the case if an ETS is issued. Just like if you think about the lockout tagout standard or the respiratory protection standard, you are required to have a written program, right? So if you don't have one, that's the violation. So that currently that's not the case. If you don't have one, they can't. I don't envision that OSHA would cite someone simply because they don't have a written COVID plan, but because that is at the center of the guidance that was issued early in this administration as one of the essential elements of a response or of your COVID measures, that if you don't have one, you're already kind of starting in a hole, if you will, when you're being inspected. I can envision that's one of the first questions that an inspector would ask, or the top of their document requests letter, provide us with a copy of your COVID prevention plan. And if you don't have that, I think again, you're kind of starting from behind. Now, if you have, 10 different policies that when taken together are a fantastic COVID prevention plan, you can bundle those together and provide those to OSHA. We just find that having them kind of assembled into a cohesive document, just makes things that much easier. Let's see, what else do we have here? I think I saw a few more questions came in. This is another good question. Do you have a sense of what would be contained in the ETS? For example, will it sweep in existing guidance that does not have the force of regulations? Yes, I mean, our thinking, and this was confirmed by talking with former OSHA officials who we work quite closely with on a consulting basis, is that if you're looking for signals as what is likely going to be in the ETS, look at the guidance that the agency is issued, particularly obviously the guidance that was issued by current leadership at OSHA. I think it was towards the end of January. And by the same token, as I said when I covered the Liberty Tax Service and the Peterson Manufacturing citations, I also think that those the feasible means of abatement that are identified in these citations are another window into what is likely going to appear in an ETS. Those are the things that OSHA thinks are the way you protect your employees, so it logically follows that those are the things that would be required in an ETS. There was a follow-up, I think, in response to my answer to the record-keeping question, asking if we don't think that the pandemic will untie the OSHA log from COVID, what stops OSHA from including common communicable diseases like the cold and flu? Well, that's because there is a specific, cold and flu are specifically exempted from record-keeping in OSHA's, in the standard itself. So that would be the basis for that. I think it's again, as long as COVID is until COVID reaches the type of condition or outcomes like you see with the cold and flu, I think we're going to see OSHA continue to expect it to be recorded. But again, that's one of the things that we recommended and called for in the comments that we submitted, is suggesting, because work-relatedness is it's such a fraught process to figure that out. We suggested that employers be required through the ETS to track the COVID cases on, in essence, a COVID log, but not have to place those on the actual 300 log. If our recommendation is accepted, I think that would then, I think that would make a lot of employers happy. It would save a lot of resources from time spent trying to make almost impossible determinations. Someone noted that there's an item in the NEP that says to not distinguish between vaccinated versus non-vaccinated individuals, and asking, is that solely for social distancing and face coverings? For example, there are different travel and quarantine rules and close contact quarantine rules for vaccinated individuals. Yeah, I think that that this is one of the areas where it's very difficult to kind of peg or predict what OSHA is going to do. I think this is one area in particular where we are hoping that if there is an ETS, that it will tie these sorts of requirements or expectations to the CDC guidance. I think we're going to be seeing a lot of rapidly developing information and guidance from CDC as more is learned about the effectiveness of the vaccine, about how long it lasts, how long people are protected, and probably, perhaps most importantly or most significantly, whether vaccinated people can in fact spread the virus to other people. I thought I had heard, or I've seen that there is some early indication that fully vaccinated individuals do not. If that turns out to be the case, then I think obviously that would have a very significant change on how employers would have to conduct themselves and the measures that they'd have to put in place. But until the science is a little clearer, I expect that OSHA will continue to not distinguish between those categories of employees. I see a question about our COVID task force. If you just go to our website, conmacielcarry.com, and you scroll down, you should be able to find an easy link to our task force and the FAQs there. So with that, I think that we can call this webinar to a close, and I'd like to thank everybody for joining us today. Hope that you found this helpful. And again, keep an eye on our blog. We're updating that pretty frequently. And as always, feel free to reach out to any of us if you have any questions or need further assistance. Thank you.